Welcome back to another episode of the Bridging Divides podcast. Guys, there are so many issues facing our youth today in mental health and in the struggles that they have to deal with, their accessibility to drugs and the influences of social media, everything going on. There are so many more things that I remember dealing with when I was growing up. I'm so excited to bring you Lindsay Taylor. She's the clinical director of the Hope Institute. Correct me if I'm wrong on anything, if I say anything wrong, just like you can throw something at me or whatever. But I'm so excited to bring you our guest today, Lindsay Taylor. She is absolutely amazing, and I love the work that she is doing. She's got a heck of a story with what you have personally been through, and what really I think that is something that is so powerful that fuels what you're doing and why you're so effective at it, I would say. So thank you, Lindsay, for coming.
Yes. Yeah. Thanks for having me, Mitch. I met you and I was like, you're an awesome dude and I love what you're doing. And I'm just super, super excited to be on here and to talk about a very important topic for sure that affects so many, including myself.
I know, right? Like families, the impact that is, that's happening with our teens, like the things that are going on impacts everybody that is connected, right? It's not just something that we can sweep under the rug or just like ignore it and hope it'll go away, right?
Yep.
Like it's something that we have to face head on.
Yeah.
So tell us about the Hope Institute. Kind of give us an overview of what the Hope Institute does, why it's different than say the other maybe services that are out there.
Sure. Yeah. So the Hope Institute is a suicide treatment center, essentially. It is an outpatient clinic where we service, at this location in Chandler, just youth at the moment. So we are treating kids K through 12 in the Chandler Unified School District who are struggling with thoughts of suicide.
That young?
Yeah. Yeah.
Really?
Yeah. So we haven't had any kindergartners, but we can. So that's the age range is K through 12. I think our youngest referral was 6, though. So pretty young, yeah. And we definitely, I will say, our elementary referrals have been a lot higher than we expected them to be.
Wow.
Yeah.
That blows my mind. Like, oh my gosh.
Yeah.
So
yeah.
what are the elementary school kids dealing with?
So
in terms of mental health?
Yeah. So, I think what's happening is, kids are getting phones earlier and earlier. They're exposed to more at a younger age. And I think that's got to be contributing to some of this increase that we're seeing in elementary kiddos expressing thoughts of suicide. Sometimes with elementary kids, it's just a matter of they don't have different language to express how they're feeling. And so they use the language, I want to die, not realizing what that really means. And so sometimes it's more just a psychoeducation piece on helping them understand, like, when you say this, that means like you're never coming back.
Right.
And so, but then there's some that are legitimately struggling with really just wanting to escape whatever it is that they're going through. And so they're going to that thoughts of suicide. So yeah, that was pretty shocking when we pulled together the data. We actually have more elementary referrals than we do middle school referrals.
Get out of town.
Yeah. And so, but going back to what we do, so we treat individuals struggling with thoughts of suicide, and we use a model called CAMS. It's an evidence-based model that stands for Collaborative Assessment and Management of Suicidality. And then we pair that with DBT, dialectical behavioral therapy. So those two evidence-based models are super effective in treating individuals struggling with suicidality. And so that is our sole focus. So once we've treated what we call the direct drivers. So with the CAMS model, we're getting to what is leading this person to have these thoughts of suicide. We call those the direct drivers. And then that's what we're focusing our treatment plan on. So we are actually trying to get to the issue of what's leading to that and actually treat the pathology, like what's leading this individual to struggle with these thoughts of suicide, so that the goal is that we can eliminate that and then they can learn how to face whatever struggles it is that they're facing and not have to go to suicide as an option.
Right.
So that's kind of our goal in our program. And then any indirect drivers, so issues like, depression, anxiety, grief, family conflict. It could be a variety of things.
Interesting.
Trauma, that might be underlying issues. That's what we then refer to an ongoing therapist once we're done stabilizing and treating the suicidality in the client.
Okay. So you work in collaboration with like the other therapists and counselors that will deal with that treat those other issues kind of so that they have the ongoing treatment.
Yeah. Yeah,
Okay,
and so there's a small percentage of clients that will come to us that won't need the ongoing counseling. You know, maybe it was just an acute situation, maybe a bullying situation, and it led that kiddo to have those thoughts of suicide. We deal with the issue at hand, and then they're fine. But there's about 2/3, I believe, is the stats of clients that will need to go on to the ongoing counseling that have underlying issues, like I said, what we call indirect drivers. So our model is designed to fit nicely within existing systems already as well. So we know that 10% of individuals struggling with thoughts of suicide, only 10% are emergent, meaning they need immediate help. So that's where those clients would need to be hospitalized first just to get that.
Like, is that, sorry, I don't mean to cut you off. Does that emergent, does that mean like they like have a plan?
Yeah, imminent danger.
It is going to, like, we need to like stop this right now?
Correct.
Okay.
Yes. So any client who's in imminent danger, we would refer to the hospital first. Of course. And that's usually if they're unwilling to keep themselves safe. So hospitalization, the purpose of that is to stabilize the client. Generally, it's a 10-day stay, and then they can come to us after they're released from the hospital to receive actual treatment. So the hospital is really just the stabilization piece, and we are interested in actually treating the issue. What is leading to these thoughts of suicide? And how it's different is, traditionally in our system, therapists, there's a lot of therapists out there that aren't trained in specifically treating suicidality and honestly aren't comfortable with it. And so, that's the work that we're doing is treating that piece. And then, like I said, any of the things that need ongoing longer term therapy, then we will refer to the outside agencies and therapists to take care of that ongoing therapy piece.
How did you find that kind of hole in, say, the counseling and therapy field?
Yeah.
Like, how did you guys come to find that a lot of them are uncomfortable or they just don't get treated? Like, how did that happen?
So Derek, our CEO, so this originated in Ohio. The Hope Institute originated in Ohio. That's where the first one is. Derek, our CEO, he's a suicidologist. He's been doing this.
Awesome.
Yeah.
Which we are interviewing him here in the coming weeks.
Yes.
So I'm very excited to talk
to that interview because he's got a wealth of knowledge, years beyond me.
Insane.
Yeah.
Oh, yeah. But please go on.
So he's been treating suicidal patients since 2008, and when the pandemic hit in 2020, I don't know what it was, but it really rocked our world, and we had so many people struggling. We had just an increase in mental health issues.
Yeah, think about it. It's like you remove people from their support systems, and without getting into the politics of everything, because I know it's like this huge like political issue, but like the fact of the matter is that people were cut off from so many of their support systems, people that they get to talk to every day that they're more comfortable with, whether it's a student or if it's somebody that goes to work. We need that.
Yeah, exactly. that connection. Yeah, as humans, we're wired for connection. And so, you kind of essentially cut that off. And it definitely, we saw an increase in our, just everybody, adults and kids, but our youth were really struggling. And so Derek saw that their practice that he has in Perrysburg, Ohio, that had filled up. And he's like, I can't have a wait list for patients who are suicidal. You can't.
Are you kidding me?
Yeah, you can't have them wait. That's
that's the opposite of what they need.
Right. And so that's when he came up with the idea to create the Hope Institute as basically a way to bridge that gap in our system, that lethal gap, if you will.
Big time.
Right, because the other thing with traditional ongoing counseling is sometimes these practices have 6 to 8 week wait lists, and again, you can't have a suicidal client on a wait list. Also, ongoing therapy, generally it's once a week, at most. And so sometimes even if therapists are comfortable treating the suicidality piece, have training in that, feel okay with that, they may not be able to see that client more than once a week.
It's just not enough.
Right. And sometimes with suicidal patients, they need to be seen more than that. So Derek came up with this Hope Institute model where it's outpatient, so you can keep kids and adults in their community, in their homes, still going to work, still going to school while receiving treatment. And so on average, it's a 6 to 12 week program. I think research is showing 5.2 weeks that youth are out of thoughts of suicide after receiving treatment at THI. But yeah, so he designed it so that we would get clients in within 24 business hours. So no wait list, get them in next day appointments, and then do that short-term care of just treating the suicidality piece and then referring to the ongoing counseling to treat in any of the other struggles that a client might be facing. And we use that CAMS model, like I said, in DBT, which is what he's been using for a long time, it's the most effective treatment that he's found and that research shows with treating suicidal patients. And then with that, about 6 to 12 week time frame, clients can come up to 4 times a week if needed. So again, it's more they can see a therapist more often throughout the week if they need to. Yes, if they need to. And then we offer a mix of individual sessions and then DBT skills group sessions. So it's all DBT skills based, and DBT, dialectical behavioral therapy.
I was going to say,
I'm using that term a lot.
Walk us through that.
So dialectical behavioral therapy, it covers 4 main things: mindfulness, interpersonal effectiveness, which is like how to have healthy communication, healthy relationships, emotion regulation. How do we manage our emotions? It's a big one. Because a lot of times it's our emotions and feelings that are leading to the struggles in our lives. And then dialectics is a part of that. Dialectics is the idea that 2 things that seem opposite can both be true. And so,
interesting.
Yeah. And so it's all about how do we find that middle ground and walk that middle path. And so for example,
you're like reading my mind. So give us an example of what that looks like, because that doesn't seem to compute like in my mind.
Yes, yeah. So what that means is, for example, I'm doing the best I can and I can try harder. So those seem like opposite things, right? But they're both true.
I have felt that.
Yeah.
Oh my gosh.
Yeah.
Yeah. I don't know if you guys have felt that. If you have, let us know in the comments. But holy cow.
Yes.
Yeah.
Yeah. So the other piece of that, I just had a client this morning that's like, I felt bad for my friend. Like, she came from a really rough home life, and also she was a really mean person. And so that's dialectics right there. Like, I can feel bad for this person. I can understand where they're coming from, and I really don't enjoy being around them. Both of those are true.
Yeah.
So that's dialectics. It's being able to see that we all have different perceptions, different beliefs, different understandings, and nobody has the absolute truth. Right. And it's all about realizing that we can experience and both things can both be true. So like another example is I can experience joy and pain at the same time.
There you go.
And those are both true. Like I can experience both in my life.
Some just kind of a tangent. One of the things, because I have 50,000 kids, which I've talked a lot about. Yeah, there's so many kids. But it was funny because they kept saying like, oh, like this is the worst day ever, when it was like one thing that like would happen at the end of the day. And I was like, it was partly selfish because I was like tired of hearing them complain, but I was like, let's play the happy game, right? So like we would go around and be like, well, what's one thing that would make you happy, right? And it could be something super ridiculous. But what was kind of crazy is that it kind of changed into the feelings game, I think is what we ended up calling it, because we would say, well, they wanted to do something other than happy. So we're like, well, what's something that makes you sad? What's something that makes you mad? And then we'd go around, and then kids are incredible. Like the amount that they understand, like it totally blew my mind when this happened just as a result of talking to my kids, but they wanted to do a challenge round. And so I was like, well, what's something that makes you happy and sad, or mad and sad, or the kind of the mixed feelings. I thought of like In and Out, or Inside Out, In and Out. Yes. I could go for a burger right now. No, but the movie Inside Out, where it's like the emotions are way more complex than just these black and white things, right? And so it was amazing though to help my my little kids, we're talking like as small as 4 years old, understand the complexity of emotion, and that they're allowed to feel
both ways. Yeah. And that's emotion regulation right there, what you're doing with them. And then that dialectics piece that both can be true. I can experience both of these emotions in the same day, sometimes in the same hour, sometimes in the same 30-minute span. I can be happy and then sad, right?
What have you noticed with your patients when they realize that they can feel both? Like, does that come as a revelation or as a shock?
A lot of times, yes. Yeah. A lot of times that's something where, that's the other thing that I think in today's world with social media, people are posting oftentimes their highlights, right? The highlights of their lives. And I think it gives our kids, especially because they can't reference a time before social media. We can, so there's a little bit of a difference there.
Interesting. Okay.
But it gives them this false sense of I need to be happy all the time. I need to be living great all the time. Things need to be exciting all the time. When really life is a lot of just mundane, boring. It's not what social media portrays all the time, but it gives this false sense of that. And so, so kids, when you start to have those discussions and then dialectics is really helpful even for like the parent-child dynamic where like a lot of times, especially in those teen years, you just don't see eye to eye with your parents and vice versa. And so it's really understanding that you both have a truth in this. Like it might seem like opposites, but both can be true.
Interesting. Yeah. That's that alone to be able to understand that.
Yeah. And then the other part of DBT is distress tolerance. So that's another skill in DBT that we teach. And that's just really how do you manage really difficult moments, difficult situations. How do you manage crisis moments without it having to go to suicide as an option? So we teach distress tolerance. That's another major component of DBT.
Beautiful. Well, it's because it's a tool. Like that's a skill. Your ability to be resilient.
Yes.
In the face of everything that is going on.
Yeah.
When we're, like you said, when we're expected to live on this high all the time, and then when something small knocks us off of that, that perch way up there, we don't need to drop all the way to the bottom. We can regulate those.
There's
those
ways
emotions.
to manage through those moments and then be able to proceed. So with distress tolerance skills, those are more like crisis. How do you manage crisis? Very difficult. Basically, how do you tolerate the situation?
Crap hits the fan.
Right. How do you tolerate it? And then from there, we work on, actual problem solving. But the point of distress tolerance is how do I just survive this moment that feels intolerable?
Oh my gosh, man! That is just so amazing that what you guys are doing there. Because I was, my wife was just talking with one of her friends about one of her children that she was dealing with these thoughts and she ended up going to a hospital for a couple of weeks and there was no treatment that was really done. It was just, we're going to watch you. And she's like, she ended up coming home with more toxic behavior and thoughts. And it's just like, well, what do you really expect to happen if they're not given the tools to be able to combat that either false information or skewed perception of the world. Yeah. So what you guys are doing is giving those students, these our kids that toolbox that they need to have for the rest of their life. Right. I mean, just because we get older doesn't mean that goes away.
No. There's many adults that don't know how to manage their emotions.
Exactly.
I wish I would have had DBT. I wish I would have been taught that a lot sooner in my life because it would have helped me too in my early adult years to have had those skills. I didn't really learn that till I started learning all this, So, and to your point with the hospital, I hear that so often.
Really?
Yes. Of, kids who go into the hospital feeling hopeless, right? And coming out feeling even more hopeless. And I think, hospitals, I definitely, they have their time and their place and their
serves
importance.
A purpose.
Yes, it serves a purpose. And so I definitely, this is not to knock on hospitals at all. But it's also I think we need to bring attention to what is the purpose of hospitals and what can parents expect from that. And I think that's where there's a little bit of a understanding, I guess, if you will, of what the hospitals do and don't provide.
Right.
And so again, I think, looking at hospitals as strictly that stabilization piece, that they're going to keep your kids safe. They're under strict supervision, and then they're going to oftentimes use meds or med adjustments to help stabilize that kid, and just keep them on a watch, until that kid feels like they can keep themselves safe. And then that's when, they're discharged. And there's some, groups and I think some therapeutic intervention that's trying to be done in the hospitals, but it's a very short time, right?
Right, absolutely.
And so really no treatment is happening in the hospital. So again, being able to get out of the hospital and then have that actual treatment piece for this is what we've been missing in our system. And so that's what the Hope Institute strives to bridge, that lethal gap, like I said. And then to also the Hope Institute, with this, we can avoid unnecessary hospitalizations. So sometimes historically, hospitals were the only option, if you will, for kiddos who are, anybody experiencing suicidal ideation. Some people didn't know where else to turn. I mean, like the once-a-week therapy wasn't cutting it. Where do I take my kid when they're suicidal? Sometimes they ended up in hospitals when they really weren't imminent danger. And so again, a lot of times, with us, we can work with that kiddo in the outpatient setting, and avoid unnecessary hospitalizations too.
Amazing.
Yeah.
Amazing. No, oh my gosh. Like, again, I just absolutely love what you guys are doing. So when you told me why you are doing what you're doing, why you got involved, it was just this. We talked for hours, when we first met, and it was because it was just this, this amazing thing that really, really touched my heart. Can you tell us about that story? I know it's a pretty heavy story, but like.
Yeah. So, it's funny because when I got into social work, so my degree is I'm a licensed master social worker. So that means I don't have my clinical licensure yet. But when I got into social work, I originally started in child welfare. I had a very big passion for like foster kids growing up. And so that was kind of the area that I thought that I wanted to go in. Yeah. And then I spent a couple years in that, and man, God bless people that work in that area. It's tough work.
It's heavy.
And so I ended up transitioning into schools, and started doing work in schools, and I loved that. Eventually led me to do a little bit of work in adoption. So I case managed birth moms that were placing their child for adoption. With that population, I worked with a lot of people struggling with addiction. And so again, every job I've had, I've actually learned so much from and loved it. And it was also different, but there was aspects of each job that I really enjoyed, and I loved that population. But then I found myself back in schools, just because it really was like the most practical for having a family and raising a family, that schedule. And I loved working with teens. Teens is like my sweet spot population. So I ended up in a high school down here. And it was through 5 years working in the school that and it was over COVID and all that. So just seeing the increase in struggles with our youth, that I really realized that we were missing resources to be able to really help these kiddos who were suicidal and to really treat the issue. I felt that, like I said, families would come back from the hospital and they felt like they didn't get the help they needed. And so it was becoming a cycle for some of these kids where they were just, repeating. So anyway, that I saw that and really started to become passionate about like, how can we actually help these kids? How can we treat these kids, right? And then it was a few years into my work at the high school that I ended up having a student who I worked with who I was close to, and he had attempted suicide 3 times previously. Wow. And helped him through each of those. And then unfortunately ended up taking his life in May of 2021. And so it was that experience and that loss that really rocked my world, and in terms of just, again, desperately wanting to find a solution for these kids and these families to help them. Because I also, from the parent perspective, saw how much his mom was hurting in trying to find him the right help, right? And so that happened, and then exactly a week, 7 days after my student passed, my son passed away from a fentanyl overdose.
Oh my gosh.
Yeah. And so while I'm helping these kids, my son is going through his own struggles, right? And I remember during that time, so this is a kid who a couple years prior to that, basically, long story short, he didn't understand why people would die by suicide. That didn't make sense to him, why people would take their own life. And we had a conversation one night about it. And here we were 2 years, year and a half later, and he's now struggling with thoughts of suicide. And we had to hospitalize him. So then I also went through that whole process as a parent on the personal side and experienced, kind of the just searching for help and not really getting it, and then not knowing really where to turn. And so here I was, a professional in the field, trying to help parents and teens struggling with these things, and then not even knowing how to help my own son. It was a really weird, helpless feeling. I'm like, how am I supposed to help these families when I can't even help my own son? It was just a very interesting time.
Heartbreaking.
Yeah. And, so he unfortunately, got in, and this is a topic for another day maybe with us, but he had got into just vaping with marijuana. It's a big thing that our youth are being exposed to.
We will definitely have another episode about we can have a whole other episode.
Yeah.
And I think it's extremely important that we do, but please continue.
Yes. So he basically, the long story short with him was he had got into that, just started out as what you would call typical teenage experimentation, and then ultimately got away from him, and that's what ended up leading to the fentanyl. And then ultimately having thoughts of suicide. I mean, his mental health tanked. It just became this downward spiral with him. And it was all within a year time frame. Prior to that, he was a competitive gymnast. He was super talented athlete. He did really well his first 3 years of high school, freshman, sophomore, junior year. It was his senior year, right before his senior year, that right after COVID, March 2020 is our marker that things started to go downhill.
A year is not that long.
No.
Like when you really we're almost halfway through. We were just talking about this. Almost halfway through.
Yeah.
It's just like, it's not that long.
No. This wasn't a kid that had these massive struggles with for years. Which is really interesting. Of course, he had some struggles, but nothing out of the ordinary, more usual, typical type struggles. So it really just March of 2020 hit. He got really heavy into the smoking marijuana, and that ultimately led down this path. So anyway, fast forward December of 2020, we had to hospitalize him, and then again March of 2021. That was when he had told us that he had tried fentanyl, and he knew it could kill him. And so that's when we put him in the hospital again, desperately searching for help for him, and just kind of coming up short for various different reasons, insurance, financial. I mean, it was all a difficult path. And so I could relate really personally to the clients I work with, and the struggle of trying to find the right help for your kid, and where do you turn to, and how do you access it. So anyway, and then ultimately going back to what that parent said about their kid not getting helped, he had journaled in the hospital, if this place can't help me, nobody can. And so again, he walked into that hospital feeling hopeless and walked out feeling more hopeless. So I really experienced that firsthand on a personal level, not just professionally. And then ultimately, unfortunately, he passed away 2 weeks shy of his high school graduation, his senior year,
so sorry.
In May of 2021.
To see any child suffer is heart-wrenching, but how do parents out there, how do you deal with those feelings with your child of helplessness to help them? Like how do you deal with that?
Yeah. So,
parent?
I think it's different for everyone, right? With how you get through those things. But I think some of the few things that we all need. First and foremost, as parents, you need your own support system. And so I always say to parents, make sure you're taking care of yourself too, and that you are reaching out and connecting with people. There's tons of support groups out there. And then, friends, family, whoever you have in your network, you definitely need your own support system to help you through. And then managing your own emotions, fears, guilt, whatever it is that you feel, I think, that's really key. As adults, we have to work on managing our own emotions through all of this. And so self-care is really important. All those things, just making sure that you're getting your own help and taking care of yourself through that. I know for me, the biggest thing that helped me through that was when I realized that I had ultimately zero control of anybody but myself. As much as I want to be able to protect my kids and save them from everything and control everything, I realized I don't have control of any other human outside of myself. Even though there are kids, as much as we want to, we don't have that. And so of course I did everything I could, to help and guide him and love him and support him through it. But at the end of the day, I had to accept that he was going to make his own choices. And I think when I finally reached that acceptance point of just not trying to control change, it kind of set me free from the situation. And I just focused on my own reactions, emotions, fears, guilt, whatever it was. I focused on helping myself. And then in helping myself, I was better able to help him and support him. And so I think we really have to emphasize as parents and as adults, even just anybody supporting a loved one, even if it's a significant other with thoughts of suicide, like make sure you are healthy so that then you can be the healthiest for supporting them.
Well, it's like if you're both in a hole, you can't really help them out of it. So you have to be able to be, come from that healthy high ground, if you will, to be able to help pull them out of that.
Exactly. Yeah. So I think that's really important. There's a book actually, and I brought it because I wanted to show everybody.
I'm so glad.
It's Loving Someone with Suicidal Thoughts. This book is fantastic. I would recommend anybody who has any loved one, significant other, a child struggling with thoughts of suicide, read this book. It's got some really, really helpful advice. But I think, aside from helping ourselves, getting our own support system, the next thing is we have to then be able to have those difficult conversations with our loved ones, and then be able to, in the book, she calls it bravely listen. So I think that's the other thing is sometimes our own fears cause us to want to push.
I don't want to have that conversation because I'm scared of how I will feel.
Yeah.
Ooh, that's...
Yeah. And so being able to bravely listen to our kids, to our spouses, whoever it is that we're supporting, and just be that listening ear that doesn't try and push away or diminish or dismiss, as much as we might want to, because it is scary to hear those things, to hear somebody talk about wanting to take their own life. So bravely listening is something she talks about in there. I would say the other thing that is so, so important to do is to educate yourself on suicide. Like, why do people turn to suicide as an option? Yeah. I think that's a really, knowledge is power. And if we can educate ourselves on why this happens, then again, it helps us to be able to better support our loved ones in our lives. And so, I like to think of it at a base level, as humans, when we experience, extreme physical pain. Let's just take that as an example. When we are in extreme physical pain, we want anything and everything just to escape it, whatever we need to do to get through that pain, deal with that pain. We're gonna fight, right, to get rid of that pain.
It's like anesthesia, amputation.
Yes,
it's all of these different extreme measures.
Right.
It's all in an effort to escape the pain.
Escape the pain. Yes. If we're in a lot of physical pain, we want to do something to get rid of it. Right. It's the same with mental pain, psychological pain, and so you have to understand that what brings somebody to suicidal thoughts is often just something is too unbearable, that there's this desire to escape it. And so that's what often leads people to suicidal thoughts, is just the need to escape that psychological pain, that mental pain. And so just understanding why people have thoughts of suicide and why that's a thing and what can lead to that and all that. And then understanding specifically in your loved one situation, what is it for them? And even if you don't agree with it, we can still validate that person and we can still understand.
Ooh, that's a big question. How do you validate someone when you don't agree with what they're thinking and saying?
Yeah. So that's another big part of DBT. The dialectics piece is validation does not equal agreement. So when we validate someone, that doesn't mean I'm agreeing with what you're saying. I'm validating your emotion. I'm validating the feeling. So I understand that this is really hard for you. I may not agree that taking your life is the right option, right? I don't agree with that. I can see that this pain is really hard for you. That's the validation part. You're validating the feeling. You're validating the emotion. You're validating the pain.
Not the plan.
Not the plan.
Or the
Not
action.
the, yes. Mm-hmm.
That alone, oh my goodness. Mm-hmm. If we as a society could better understand that validation does not equal agreement,
yes.
How many problems would we have, whether it's political or religious or like all of these different things that we can validate and connect with that part that we do feel for them, but we just, agree to disagree.
In a very simple way. It's just, I see your point. That's it. That right there is validation. Even if I don't agree with your point, even if I don't agree with your belief, I see why you believe that. I see why you feel that way.
Amazing.
That's validation right there,
Amazing. Oh my gosh. I knew we've had these conversations before, but I knew that this interview was just going to be absolutely amazing. And if you guys have gained value from this, please like, comment, subscribe. All of that helps get more attention on this issue. And I'm super excited to talk to Derek too about more getting into what causes suicidal thoughts, and just he has a wealth of knowledge in that arena. But your insight and your expertise have just been absolutely eye-opening, jaw-droppingly so. To see how much is going on and how much further we have to go. But just like your name hints at, is that there is hope. Ultimately, I think that is what we need to hold on to going through all of this, is to have that hope that we can get better, we can help our children, we can help ourselves, and we can get through it.
Yeah.
Last question here as we land the plane. Why is it important for us to talk about suicide? Because so many times I have heard, stop talking about it. It's making it a bigger issue than it is. Why is it important to talk about?
Because what you leave in the dark just gets darker and harder. And so what I mean by that is, if we're not talking about it, if we're not sharing about it, people feel it plays into stigma, right? Like, I can't talk about this, and so I'm going to hold it in and suffer in silence, which actually leads to bigger issues. And so I think that by talking about it, that allows people to get the help that they need, right? And that's ultimately what we want. We want people to be able to get the help that they need so that they can build a life worth living. That's the whole premise of DBT, is to build a life worth living. And you can't do that if you don't talk about it, right? And if you don't address it. And I think when we keep it in the dark, when we don't address it, we're just playing into that stigma. And we have to, this is 2024. Like,
gosh, I can't believe it.
It's time that we start acknowledging that this exists in our world, and how do we help people find that hope? How do we help people build that life worth living? The only way we can do that is by talking about it and by letting people know that there is help, there is hope. I think that's a really, really important piece to why it's so important to talk about it, because we want people to get help. We want to save lives. At the end of the day, that's the bottom line. And so it needs to be talked about. It needs to be addressed. And we're going to keep, fighting the good fight of trying to save lives and help people feel brave enough to come forward if they are struggling.
And it's not, when you shine a light on something, it becomes less scary.
Yes.
The fear is in the not knowing what it's about, why, what's affecting it, what's going on, say with drugs or social media or all of these different things, so when we have that light shined on it, it becomes less scary.
Yeah, exactly.
And we're better equipped to deal with it.
Yeah. Yeah.
So, oh my gosh, thank you so much again. And we will have you back on because we have there's just so much more to talk about.
Yeah.
And just in different things, different ways that we can combat those individual factors that are affecting our children's mental health that we will definitely get into more.
Yes.
And if some of the things that we have talked about you want to hear more about, please let us know in the comments, because that lets us know what you guys want to see more, what you guys are needing to hear more. Please let us know. And guys, there is hope. I promise there is hope. Lindsay is a perfect example of how to work through it as a family, and seeing how she has dealt with this horrible, painful experience, and just turning to her family and using that pain to help other people. We can all do that. That's why I have Bridging Divides. That's why I'm doing this whole podcast, is because that is how it helps me move forward. We all move forward by working together. And as I like to say, bridges are built from two sides, and none of us succeed alone. We succeed together. I love you guys. We'll see you on the next one.